February is Heart Health Month, starting with National Wear Red Day on Friday, and our friends over at Desert Oasis Health Care have a very important conversation to have with all of us in regards to a healthy heart. So our friend Sandy Newton sat down with Dr. Edith Jones-Poland and board member Hank Wasiak to have this very crucial conversation around the Desert Chat table. Here's that conversation.
Welcome, Doctor, and welcome, Hank. So nice to have you here. And we want to remind everyone that next week starts National Heart Health Month. So, Dr. Jones-Poland, you're already wearing your red, which will be Friday, February 3rd. But, you know, we really want to impress to our viewers the importance of heart health, and particularly women, but of course everyone. And, you know, Hank, you were saying there's been so many incidents recently with heart episodes, and weren't we fortunate that there were people there who knew what to do?
Yeah, those episodes were cardiac arrest.
Yes.
And we were fortunate because if you apply hands-only CPR, which we talk about in that little kit, the incidence of surviving it will go up 2 to 3 times. Just think about that. That's
wonderful.
Amazing. So you, as an individual who knows that, can be a hero and save a life.
Yes, you don't have to be a doctor to do hands-on. So explain to our viewers what actually hands-on is.
Yeah, so hands-only CPR is actually replicating the normal pumping of the heart. So before a person has a cardiac arrest, they should be oxygenating normally. So they have oxygenated blood, but they just don't have the heart pumping it. So when a person applies chest pressure and the pumping of hands-only CPR, it's replicating the pumping heart.
But we want to talk about the fact that it's important people realize, specifically in this month, that women do really have a greater risk of not maybe recognizing some of their symptoms and not calling a doctor or really getting the proper attention.
Yeah, so we talk about that. We highlight that in Go Red for Women especially, is that women sometimes don't recognize the symptoms, and their symptoms can be a little bit different. Typically, women still have the chest pain and pressure and shortness of breath, but they can also have associated symptoms like nausea and dizziness, things like that that may not be perceived necessarily as a heart attack.
Yeah. And it is the leading cause of death in women, heart disease. It's something that we gloss over, but more than all cancers combined. And women tend to push it off a little bit more than men, and it's unfortunate. So anything we can do to raise that awareness, we'll do.
And of course the luncheon, tell us about the luncheon as well.
Yeah, so the luncheon is coming up April 14th, and that's where we really ask everybody to really focus, again, wear their red, and help to bring attention to those that have been affected by heart disease and stroke.
Great, and where can they go for more information on the luncheon?
The luncheon website is cvgoredluncheon.heart.org.
Perfect, perfect. Well, thank you so much, and thank you for bringing this information. And again, hands only is such an important, easy to remember way to perhaps save someone's life.
Yeah, staying alive.
Staying alive.
Especially for women, because they've done research and shown that women are less likely to receive CPR.
Really?
Yes, so actually part of the Go Red for Women mission this year is to ask that one person in every household learn hands-only CPR. Because we know that it can double or triple the likelihood that someone survive.
Wow.
Yeah.
Well, that's so important indeed. Well, definitely. I'll be practicing as well. So thanks so much for bringing it to us, and we'll see you hopefully at the luncheon.
Thank you, Sandy.
Thanks so much.
Thanks for having us.
Thanks.